Welcome to Evergreen Family Medicine. Today we are with the CEO of Evergreen, Dr. Tim Powell, and the topic today is the Sutherlin Clinic, which is now open and beautiful and amazing. So take us through some of the high points for you when you think about that new Sutherlin Clinic.
It's hard to know where to start. Brian, we are so excited to be in that Sutherlin Clinic and offering services to Sutherlin and North County. It's truly the realization of a dream that started in 2015. Evergreen has a partnership with Mercy Medical Center to establish primary care throughout Douglas County, and our highest priority was Sutherlin and North County. There's been so many challenges getting to this place. That's all behind us. I don't want to revisit that. But I'm so proud of my team, so proud of what we're able to accomplish, and so proud of what we're able to offer Sutherlin and North County. I will say this, the City Council, the planners, everybody from Sutherlin has been incredible in their facilitating and welcoming us to that. We are invested emotionally so much in that town and in that county. It's gorgeous, wonderful place to live, and great people. So I'm just beyond excited that we're now able to offer our full services there.
Talk about what this means from Evergreen's point of view to the people of Sutherlin and North County and your commitment to quality health care, which has always been Evergreen's banner for sure, but not just Sutherlin, obviously North County. I mean, we talk all the time about access to healthcare, and this opens a big door.
Well, it does, but you know, it's a commitment to that community, to us also. It goes both ways. It has to. I was invited to discuss our Sutherlin Clinic at a mobile home park there to some very active seniors. And it was so much fun. There was over 100 people in that clubhouse, and I just enjoyed it so much. As I've went around in the community and talked to people, everybody's so excited about working together to bring health care to Sutherlin. And so yeah, we're going to bring everything we have to that project. North County's around 15,000 people. We don't think of that as we think of Oakland and Youngcall and Drain and Elkton and all of the other unincorporated areas. And so we're going to be there. We're going to have our chronic care nursing into all the assisted living facilities there that allows us to do an exam with the nurse present, listen to the heart and lungs and look in their ears, nose, and throat just as well as we could in the office. We're going to offer these things as well to the schools in North County, where we can provide health care on site there. And all of this, as you said, is access. We're going to be open 7 days a week. And we're going to be open in urgent care 7 days a week and family medicine 6 days a week. We'll have, as we start there, 3 family physicians, 2 physician assistants, and 2 urgent care people there. And we're going to plan to go to 12 because we fully expect Sutherlin in that area to grow. There's just no way it won't. It's so gorgeous, so well situated, and such forward thinking city council and planners. So it's just such a pleasure, such a relief, and I think the people that come there are going to appreciate that passion, hopefully in the care that they get.
Talk a little bit about the layout of the building and the reason for some of the structural decisions that were made.
One of the things we've always worked at is to make a large practice into a small one. And so we have what we call pods and kind of open areas where people can really get to know not just their physician, but the nurses and the other people that are working there. So it's situated in that way. It's also situated in a way where we can really share resources. And what I mean by that is if the family physician has open areas, he can easily go over to urgent care and help them catch up and see those people as well. We're going to have X-ray and lab there. Mercy's helping us provide that, not only just for immediate needs, but people that have lab orders from other physicians or in the community. We'll see anybody that walks in. And access also means when people are seeing another physician, that's great, you know, good for them, and they should stay with that physician. But if it's Saturday or Sunday and they need care, come on in. We'll take care of you, and we'll get a note back to your doctor so they can see what we've done and what the concerns were.
People who are familiar with the Harvard building for Evergreen are going to recognize some architectural similarities as well. It's pretty clear that the same crew that built the Harvard Women's Health campus building here on the west side of town also were involved in that Sutherlin effort. Describe for folks some of the reasons for the decisions that were made that make these two buildings look a little bit alike.
Well, Richard Sugars from Two Form was the architect who really was able to bring our thoughts, our ideas into reality. A lot of light, a lot of open windows. As a matter of fact, we're going to have to darken some of those so that the sun doesn't get it too hot, but it's so much open air coming in to where people want to live and breathe. And then the open areas, and I call it, or I think of it as our kitchen, just like a kitchen in a house where people tend to congregate and talk. This is an open area where all of the MAs and the ward clerks and people that are working to support the providers are all together. They can see one another, see when somebody needs some help, getting behind and jump in. And the people that come to see us, the patient, can kind of see who's behind the scene there. And so it's open, open both to the outside and open on the inside. And we love that type of a feel.
Well, it's very obvious that you are very excited about the Sutherlin Clinic. The amount of work that's gone into it is obvious as well. And it sounds like just another extension of the commitment that Evergreen has made to the community. Any other thoughts that you want to share about the significance of
Brian,
this?
all the work that got us here is behind us now, and now the view is totally forward what this clinic can become. And I ask the citizens of Sutherlin as they drive by and they see our lights on, just to pause and say a prayer for us, that we're able to really provide the level of care and compassion that we intend, and that the goals that we have set for this building, this clinic in our community, will come to pass.
Terrific. All right. CEO Tim Powell on the new Sutherlin Clinic. You can follow everything happening with Evergreen Family Medicine at evergreenfamilymedicine.com, and follow Evergreen on our social media channels, YouTube, Instagram, Facebook, and Twitter.